Are you having more pain and inflammation in the joints a few months after COVID infection? Let's talk about that. Hello, this is Dr. Siddharth Tambar, expert in rheumatology and regenerative medicine. A clinical scenario that I see at times is someone who presents with pain and swelling in the joints, and they mention that they've had a COVID infection 3 to 4 months previous. Recently, I saw a young woman who had a similar presentation describing finger and toe stiffness and wondering, is that COVID infection possibly related to her current symptoms? So what's going on here? The first is that in the rheumatology literature and for rheumatologists, there's this understood concept of post-viral arthritis or reactive arthritis, where essentially your immune system, which is meant to protect you from bacteria and viruses, is doing its job appropriately. There's some sort of similarity either on a protein expression or some other expression of the infection and a cell in your body, and your immune system accidentally, even after the infection has been resolved, continues to stay active and accidentally attacks those same cells that had a similar genetic or protein expression on their cell surface, resulting in inflammation in that tissue. In reactive arthritis, that's inflammation in the joints. This phenomenon can occur a week, a few weeks later, and can last for a few weeks or even a couple months, typically. Second idea is if you have a persistent viral infection, even if mildly still present, your immune system may stay hypervigilant and hyperactive, thus leading to inflammation in your body, possibly also inflammation in the joints. This concept of long COVID can apply to either one of these scenarios, meaning it can be a scenario where there's a small amount of persistent virus in the body causing the immune system to stay hypervigilant, resulting in inflammation in the joints. Or it can also be a reactive arthritis scenario where the infection has resolved, but the immune system is accidentally recognizing your own body in the same way that it was for the infection and is causing inflammation in the joints. And in that scenario, for long COVID, has been shown that that can occur for 3 months later, typically, but there's even cases where this is occurring 1 year plus, and it's a difficult thing to control. The third scenario is that the COVID infection may be totally coincidental, and you may have developed inflammatory arthritis regardless of that prior infection. Rheumatoid arthritis occurs in approximately 1% of the population. Psoriatic arthritis occurs in 20% of psoriasis patients. And there's various other inflammatory arthritis conditions, things like gout, pseudogout, ankylosing spondylitis, lupus, there's other autoimmune conditions. So it's possible that your prior infection had nothing to do with your current presentation, but rather this was something that was due to develop anyway. So how do you diagnose the difference here? And it's important to diagnose the difference because how we treat it is going to be different. To begin with, do you truly have inflammatory arthritis? Important to recognize this. Do you really truly have inflammation in the joints objectively? Sometimes wear and tear arthritis like osteoarthritis or tendinitis can also feel like inflammation, but it's not the same kind of thing as when we're talking about inflammatory arthritis where your immune system is attacking the joints. So do you objectively have signs of inflammation in the joint, either on examination when your physician is examining you, on your blood work if it's showing inflammation, or on imaging like ultrasound or MRI? Does it show that you have significant inflammation in the joints, or do you really just have wear and tear arthritis? Secondly, if there is some overlap between these conditions, and we need to rule out conditions like rheumatoid arthritis and other types of inflammatory arthritis, you should get some additional antibodies checked. Certainly for rheumatoid arthritis, like your rheumatoid factor and CCP antibody, and possibly some other antibodies as well, like an HLA-B27 test, possibly some other antibodies if there's some concern that you may have a lupus-like condition or something similar to that. And then, of course, if you've got some other systemic symptoms that are concerning for possibly a persistent infection, it's likely worthwhile checking to make sure that you don't have a persistent viremia or presence of COVID that's still active in your blood in your system as well. And again, lastly, could this just be another condition? For example, pain and swelling in the joints can also occur in hypothyroidism. Pain and fatigue can also be seen in adrenal deficiency. So make sure to get your thyroid levels checked, make sure to get your cortisol level checked if that's the case. And in addition, low vitamin D and B12 can also cause pains as well. Not necessarily inflammation, but can still cause pain. So make sure you get the right diagnosis first. From a treatment standpoint, again, there's going to be some difference here. For post-viral arthritis or reactive arthritis, where again, your immune system is overreacting, but there's no active infection, typically this is self-limited for a couple of weeks, a couple of months max. Typically it's conservative care, taking anti-inflammatory medication, pain medication, and just sort of letting your body work itself out of this. In cases where there's too much inflammation, steroids short-term can be utilized to help calm things down. Rarely, But in some cases, if a condition remains persistently active, reactive arthritis, you can still utilize disease-modifying treatments to help reduce that overactivity of your immune system. Secondly, if there's more evidence that you have a rheumatoid arthritis, psoriatic arthritis, gout, or some other condition that is chronic inflammatory arthritis, get that treated appropriately with medication. For a lot of these conditions, it's utilizing disease-modifying treatments. That's the right way to treat this at that point. And then lastly, if this is more of a long COVID situation, again, if this is no active infection, then it's more conservative management. If there is some evidence of infection, then obviously get that treated. I would recommend, if you're in that long COVID camp, that consider getting evaluated and treated at a long COVID clinic. They're going to have a lot more experience and know-how, as well as what's really working for patients to help treat you and get you to feel better. So pain, swelling in the joints after a COVID infection, even a few months after COVID infection, there's a number of things you need to rule out, including, is it reactive arthritis? Is it possibly persistent COVID? Is it more like a rheumatoid arthritis, psoriatic arthritis picture? You can differentiate between all these, get a proper diagnosis, get treated, start to feel better as well. Thank you for your time today. Give us a like, subscribe to the channel. Until we connect again, have a good day and live well. Bye-bye.